I'd like to start with thanking the organizers for giving me the opportunity to participate in the symposium. I'm Richard. I'm the founder and the leader of the Drug Innovations Group based in the Department of Chemistry at the University of Ghana. So I've always wondered why, with all the tools we have, malaria still remains a major problem with the staggering statistics that we read about every year. Several tools have been developed over the years, but looking at the ongoing activities, I have some hope that yes, we can put our efforts together to accelerate the development, elimination of malaria. So in this presentation, I'll be focusing on advancing the application of current tools towards accelerating the elimination of malaria disease. So my roadmap, basically, several vector control and chemopreventive tools have been developed over the years and are being implemented. But in the interest of time, I will only briefly mention these tools. But my talk will mainly focus on biologics, where I will be discussing monoclonal antibodies as well as vaccines, and then small molecules, looking at long-acting injectables and next-generation anti-malarials. So existing vector control tools that we have include genetic modifications of mosquitoes. This looks at genetic engineering techniques such as gene drive that seeks to modify the mosquito and therefore limit their ability to transmit the disease. We also have biological control tools such as these are natural predators such as mosquito fish or bacteria that limits the ability of the mosquito to transmit the disease. We also have the attractive toxic sugar baits. Basically, this is sugar laced with toxins that attract and kills the mosquitoes. And then we have the insecticide treated net or long-acting insecticide treated nets, which basically offer physical protection by blocking and killing the mosquitoes. In terms of chemo prevention, these basically aims at maintaining positive or protective drug levels in the blood and clear existing infections, as well as prevent new infections. Key strategies under chemo prevention include seasonal malaria chemo prevention, intermittent preventative treatments in pregnancy, perennial malaria chemo prevention, as well as intermittent preventive treatment in school-age children. Focusing on my talk, which is the main thing I want to discuss here, we look at the next generation vaccines. The key is that the introduction of the two malaria vaccines, the RTS and the R21 vaccines, is a major milestone in the fight against malaria. They are saving millions of lives, particularly young children who are actually the future of the world and therefore very, very important tools. However, there are some limitations. One, the efficacy is moderate and the protection they provide wanes over time. So looking at the future, the next generation anti-malarials should focus on technologies or techniques that will be better than the RTS and the R21. So our efforts should focus on mRNA vaccines, as well as genetically attenuated vaccines, transmission blocking ones, and also nanoparticle platforms. The main goal for this next generation vaccine should be to improve efficacy and durability, as well as accessibility and scalability should be addressed in the next generation vaccines. But most importantly, these new next generation vaccines should have a broader impact, so it should be effective across the various age groups. Currently, these ones are more effective in young children, but we want the next generation vaccines to have that broader impact. What is exciting is that these technologies are being developed and they are at various stages of clinical assessment. So we have the genetically attenuated parasites which are being implemented and is in clinical trials. We also have ongoing efforts in mRNA vaccines, and there are several efforts across various groups looking at the effectiveness of the vaccine across the malaria parasite life cycle. So this is very exciting news, giving us hope that we can accelerate the elimination of malaria. That said, we still have some key limitations to the current vaccines. One, they need to be, in year one, they need to be administered thrice, and in subsequent years, years 2 and 3, we need a booster for them to remain effective. So these we have to overcome in a next generation vaccines. The other key point is that whilst viral diseases usually bring sterilization response over time, that isn't the case for malaria at this moment. So there's a lot of work that we need to do in that direction. Importantly, the next generation vaccine must provide multiple year protection, and therefore we need to really put a lot of effort in to understand the immunity or the immunity of the parasite. So specifically, these vaccines must possess improved efficacy. They should offer longer lasting immunity and target multiple stages of the parasite. But as I said earlier, it must protect the entire population and not just a subset. The next intervention or tool I want to talk about is monoclonal antibodies. So monoclonal antibodies are showing a great promise in various disease areas, and us also offering hope for accelerating the elimination of malaria. They are therefore very promising future innovations for malaria. What they do is they provide passive immunization by providing immediate protection, either by neutralizing the malaria parasite or by preventing it from entering into cells. Great intervention and giving us hope for the future. In terms of future strategies, therefore, these monoclonal antibodies to be developed must provide long-acting protection to prevent pre-exposure prophylaxis. They must also be biospecific in the sense that they should protect both the parasite and also entering into cells. But key is that these monoclonal antibodies should give us the opportunity to combine them with other interventions to make them more effective and help in accelerating this. Again, there are ongoing efforts across various groups in developing different monoclonal antibodies. So this table just highlights that, showing the various examples of monoclonal antibodies that are undergoing clinical development, the targets, as well as the stage of the life cycle that these monoclonal antibodies are effective at, the various stages in terms of clinical evaluation of each of these, and the groups that are actually supporting or working on this. I will focus on L9LS because this is the most advanced of the monoclonal antibodies so far. This was the initial assessment. The in phase one, a phase one trial. It shows that it works with the appropriate dose. It offers protection of children and pregnant women. The initial TPP was about to protect the child for 3 to 6 months, but obviously we need to go beyond that. The other thing that, it's important to be considered in the future is the cost. So we need to develop technologies that will bring the cost down so that it will be used widely. In phase 2 trial, the L9LS show again protection, good protection in both young and pregnant women. And this graph basically highlight that with about 150 mg, it offers about 67 protection. So great promise going forward. I also want to talk about long-acting injectables. These long-acting injectables are molecules that are administered, and the active form of the compound is released slowly over a longer period. And these techniques are currently being used in various chronic conditions such as psychosis, bipolar disorder, hormonal, contraceptive, and infectious diseases. So a great tool to develop. The key benefit is that it improves medication adherence as well as prevent relapses. So the key thing to learn about the use of monoclonal long-acting injectables is the fact that it's been used in the area of HIV protection or HIV management and prevention. Example is cabotegravir, which shows that 98% of participants who were involved in these trials had no viral suppression or undetectable levels of HIV after 48 weeks. This is great promise, and the question is, can this be used for malaria? The answer is yes. So we have 2 molecules which was developed in partnership with MMV by various groups, which are in clinical assessment as used as long-acting injectables. Again, the clinical trial results show great promise that yes, this can be used to accelerate the elimination of malaria. Even in combination of the 2 provides better protection. The last part of my talk basically is to discuss next generation antimalarials. And the next generation antimalaria must have a very high potency, novel mechanism of action. It must be single dosing, preferably to ensure adherence. It must be active at multiple stages of the parasite. Besides that, it must have a very low propensity of developing resistance. So we have several examples of these molecules that tick the box as a next generation antimalaria. For example, non-artemisinin combinations such as ganaplacide and lumefantrine, molecules that have the ability to be used as a single curative drug, long-acting injectables, as I talked about earlier. But most importantly, we should also have molecules that are toxic to the mosquito in the blood, but safe to humans. So several molecules are currently undergoing investigation towards use as next generation antimalarials. So what are my key messages? My key messages is that there's hope that we can accelerate the elimination of malaria, but for us to get there, we need to develop innovative tools that will address this, innovation tools for diagnosis, innovative vector control tools, biologics, as I've highlighted, as well as new molecules. These new tools must be sensitive, they must be specific, they must be cost-effective, durable, and easily deployable, even in low, limited settings. They must overcome limitations such as drug and insecticide resistance and must be effective, particularly in the asymptomatic parasite reservoir. And then, obviously, as we develop these tools, we need to have a system in place to monitor progress and to ensure that they are actually working, and therefore we should have computational and mathematical tools available for us to really monitor progress of these new tools. So I am excited about the future, looking at the tools that are coming up, that we can indeed accelerate elimination of malaria, and I look forward to interactions on this. Thank you very much.